So let's start with a little about yourself and a little about the work you do at Innovaccer.
Oh, that's great, thanks. Kyle, I'm a physician
Yes.
and train in family medicine because I was interested in how do you take care of preventative care toward people.
Yep.
Trained at UPMC. We decided to build a health plan. I got interested in this complicated world of healthcare.
Yep.
30 years I've been helping build this company called Optum, was at McKesson for a decade, and then I thought data is the answer.
Yes.
And so for the past 7 years I've been Chief Medical Officer of Innovate.
Awesome. So let's start with a big question. It's a buzzword that kind of came about during the pandemic, but digital transformation. Can you just kind of break it down, nuts and bolts? What do we actually mean when we say digital transformation?
Well, from a simple standpoint, it's how do we use computers and computer science in healthcare?
Yep.
Healthcare lags behind every other industry. So when I train and when I practice, and still, I'm so used to going to the door and pulling the paper chart off, or going down to medical records and getting the big stack.
Yeah.
So I think what happened was we had a recession, the Great Recession, between George Bush and Obama coming into office. And we decided to, let's use that opportunity to stimulate the economy by creating electronic health records.
Yes.
$80 billion set aside for HIEs and EHRs as an incentive program. The challenge is we now use computers in healthcare, like from the front end of taking care of a patient, but it solidified the world in the way it operated, which is a very expensive healthcare world. And so now we have not digital, but a journey into digital. So now we're doing things like cloud and artificial intelligence, and thinking about how do we leverage all that information that's being collected.
Yeah. Let's get on to the power of data. You know, you just talked about healthcare generates a lot of data. It may not be structured in the way that's useful, particularly when we start talking about AI, but just talking about, you know, the potential to make this data, I think actionable would probably be the starting point.
Yeah.
So let's start there. Like how much potential can data really unlock in medicine?
A couple things around unlocking the data. One is, unlike other industries, this is complicated. There had been no standards in terms of how we code for things in healthcare. You have to code for things if you're going to use computers and do analysis, right? So the Affordable Care Act did something. It created some standards. ICD-9 for diagnosis, CPT for procedures, for billing codes, and RX norm for meds, for billing. That was it. Nothing else. Nothing. There's still, even just back then, everybody had their own codes. They just made them up in-house. Payers, providers, etc. So we have some standards for billing transactions, not much else. So really what we have is a big challenge of how do we bring data in from lots of different places. You've heard of social determinants of care. And then start to figure out a way to standardize that in a way that's smart, and then make that information good for analytics, and then make the insights from the analytics actionable when you need them. Help people take better care of patients, help patients take better care of themselves, and know what they need to do, and make it super simple when they need to know.
I know it's difficult because, you know, about 20% of GDP is healthcare spending, but can we talk about how you think envision data generating savings, or maybe better spending of the resources that we actually already allocate to healthcare?
What is savings, right? So we spend 2.5 times the amount of money that any other developed country, any of the other 20 economically advanced countries in the world. So why? The other interesting thing is we have the lowest quality indicators. So if 20 indicators in terms of the healthcare assessment of the healthcare system, we rank at the bottom of those highly developed countries, all except one category: costs. We rank up at the top.
Woohoo!
So the bottom line is because we have so much fragmentation, or what the Institute of Medicine has called waste. A third of the money, perhaps more depending on the study, is waste, meaning it's money that doesn't need to be spent. 20-25% overhead, largely administrative costs, inefficiencies, rerouting. How do we make that all cleaner, like other industries? Banking. I can go to a bank anywhere, right? Get 100%. My money, transact, everybody else knows it. How do we take that waste out of the system? That's where the opportunity is.
Now, let's talk about in the realm of innovation. Obviously, we've got new technologies that are already transforming other industries. Healthcare is a laggard in many ways. One is the adoption of emerging technologies for sometimes fair reasons, privacy, security risks. Obviously, we have HIPAA, we have protected health information. But let's talk about, you need data to innovate. And with these systems, you need lots of data.
That's right.
So how can the healthcare system really use data that's already being generated to innovate? Maybe it's in care delivery, maybe it's in utilization. I'm curious what your thoughts are there.
So some people have referred to what the opportunity is in front of us as the great unlock.
Yes.
Most of that data, even if it's not standardized, is still locked up in different systems. And it's black box, if you will. And so part of what we do at Innovaccer is to figure out how do you unlock that data. How do you bring it together, even though it's not standardized? How do you harmonize it?
Yes.
And then start to be able to use it in different ways, to do analytics, to do prediction, to then put insights into the workflow, just like we get when we're driving our car. It says, turn right, there's an accident ahead.
100%.
It'll save 13 minutes. For anybody, patients, doctors, administrators, everything else. So that's the goal that we really want to do. So we named our company Innovaccer, meaning Innovation Accelerator.
Gotcha.
Because if you can unlock that data, harmonize it, make it useful, you can start to innovate on top of it. Because once it's unlocked and it's harmonized, you know what's going on at a patient level, at a practice level, at a system level, hospital, payer. And then you can start to say, here are all the challenges that we can actually make advances in and begin to innovate on top and see, does it work, does it not work? Because you have to iteratively innovate to see what works and what doesn't.
And then last question is really about the cloud, the role that cloud can play. I was having a conversation recently with a CIO, and we talked about it's creating like a really big sandbox for innovation, experimentation. You know, obviously we want to improve care delivery and outcomes, but we also want to fuel research to get a step ahead and hopefully cure some diseases that decades ago maybe seemed incurable. I'm curious about how vital the healthcare cloud is to really innovating and advancing healthcare.
So we were born out of this concept. Our founders, they weren't thinking about healthcare per se. The original use case was, how do you get researchers in different academic institutions that are working on the same problem to innovate in real time?
Yes.
And the idea was to leverage the cloud for that. Be able to have a source they could all go to in the cloud, and then be able to share their data, share their learnings, iteratively learn from each other, and start to innovate very quickly. Our founders discovered healthcare had a very big problem.
Yes.
And being big, bold idea thinkers, they thought, let's just do healthcare. More importantly, if you're going to work in any one industry, you have to really go deep in the industry to solve a problem. You have to understand the context. And that's the other piece, is the context of the data. The cloud allows different folks to collaborate. So even right today, within a health system, the marketing department, right, which is dealing with patients, trying to get services or refer them, the actual flow of the patient through the system. Some patients want to go out to a different cardiologist than it's in the system. How do you get all those people to collaborate? Down the road, how do you get payers to collaborate with providers and pharmacies, right? So this is a healthcare ecosystem in a private and secure way that we can do, even in the American healthcare economy, which is highly private. How do you get all that to front? You can only do it in the cloud. You're not going to all build one big data warehouse and work off it.
It sounds very much like a learning health system, which was a kind of trendy term before the pandemic. I can tell you're smiling. So are you optimistic? Are you...
Absolutely.
And why?
Why? Well, if you've read Malcolm Gladwell's books, right?
Yes.
People get pessimistic because they think, well, we've been trying to tackle this for a long time and it hasn't happened.
Sisyphus,
Fall of the Berlin Wall. Like, okay, is this ever going to, it's never going to change. And what happens is things build up to a point where the system is no longer sustainable and it quickly changes. Malcolm provided tons of opportunities over human history about how that happened so quickly. The steam ships, and how they took over the sailing ships. It just took forever, and then when it happened very quickly. So I think we're at that point right now. We have these large language models that allow us to do some very interesting things where you can now talk and converse with computers, not just have to type in code and do SQL queries. We have hospitals that are really finding that buying other hospitals is not a solution for them to be economically viable.
Correct.
And we got payers trying to figure out that denying care is not the only way, right, to really be more successful with pre-auth utilization.
Yep.
At some point, this is going to start to transform very quickly, and I think the digital solutions are here to start to being able to leverage for that tipping point.
Well, excellent. I really appreciate your time. I'm glad we had a chance to sync up here at HIMSS 24, and I wish you best of luck.
Thank you.
Thank you.
Appreciate it.